Hello, I'm Rose Freck with the Center for Community Solutions, a nonpartisan research and policy institute. Welcome to Human Services 101, a straightforward guide to the social services in Ohio. Our goal through this project is to provide easy to understand yet comprehensive information on the important social service systems that help Ohioans. In this segment, I'll provide a brief overview of the structure of the human services in Ohio. If you want to dig deeper on this issue, check out the complete guide, which includes extra data and graphs, as well as links to other resources. Additional videos on other areas of the human services are also available on our website at www.communitysolutions.com. Human service, or social service systems, are complex, and no single entity is responsible for coordinating or funding these critical supports. Services and benefits are both administered and funded by the federal and state governments, as well as local governments, service providers, and philanthropy. Some of the major departments and agencies involved are listed on your screen. Many of the services discussed in this primer are means tested, so that eligibility is based on income levels. For 2016, the poverty guideline that the federal government uses to determine eligibility for many programs and benefits, known as the Federal Poverty Level, or FPL, is $11,880 per year for the first person in the household, plus about $4,000 for each additional person until you reach a family size of 9 people. Eligibility requirements for services and programs generally specify that, among other criteria, household incomes fall below a certain percentage of the FPL. For example, 50% of the FPL for Ohio Works First, or 130% of the FPL for the Supplemental Nutrition Assistance Program, or food stamps. Poverty can be measured in relative or absolute terms. People in relative poverty are poor compared to those around them. For example, the European Union uses a relative poverty measure that takes median income into account. Absolute poverty means that people do not have enough money to purchase what they need to survive without taking into account the relative wealth of others. In the United States, we use an absolute poverty measure that is determined by the government and varies by family size. Many advocates find the current mechanism for measuring poverty inadequate. In the United States, poverty levels are sometimes referred to as poverty thresholds or poverty guidelines. These measures are similar but have some important differences when it comes to the administration of human services. Poverty thresholds are determined by the U.S. Census Bureau to statistically calculate the number of people in poverty. The poverty threshold varies by family size, number of children, and in some cases, whether or not the head of household is elderly. 16% of people in Ohio had incomes in the last 12 months that were below the poverty threshold. Poverty guidelines, previously discussed, and often referred to as the federal poverty level, are set by the U.S. Department of Health and Human Services for use in determining eligibility for programs. They vary by family size and geography. There is one set of guidelines for contiguous states, one for Alaska, and one for Hawaii. For the purposes of comparison, in 2015, the poverty threshold for a family of 1 adult and 2 children was $19,096. For a family of 3 in the contiguous U.S., the federal poverty guideline was $20,160. Local nonprofit providers are the backbone of social service delivery, providing a myriad of services to those in need across the state. Local nonprofits include small local neighborhood houses, large and small multi-service organizations, and program or issue-specific agencies. In many areas of the human services, local nonprofits are responsible for day-to-day service delivery and employ the many helping professionals who have the most contact with consumers. According to the Ohio Association of Nonprofit Organizations, in 2013, there were over 14,000 tax-exempt charitable nonprofits in Ohio. Over 35,000 nonprofits were registered as nonprofits, but only about 14,000 filed as tax exempt. Human services, housing, and youth services make up about 1/4 of the nonprofits in the state. Most local social service agencies are charitable 501c3 organizations. A 501 is a tax-exempt nonprofit organization, and there are 29 types. 3 is the most common and includes charitable organizations, animal rights, religious organizations, and education organizations. 501c3 organizations are generally not exempt from all taxes, including payroll taxes and some state and local taxes. However, these organizations can collect unlimited amounts of contributions from individuals and corporations, which are tax deductible. Due to their tax-exempt status, these organizations have some restrictions on their political activity, including lobbying. Nonprofits can and should advocate around issues and causes that impact their work, and in most cases can even use charitable contributions to do so. However, it's important that organizations are familiar with the specific restrictions. Social service nonprofits generally receive funding from a variety of sources, including grants, contracts, and charitable contributions. While the funding mix varies greatly among individual nonprofits, overall, the primary sources of funding are fees for goods and services, including reimbursement from Medicaid and Medicare, accounting for 74% of aggregate nonprofit revenue. Despite the reliance on fees for services, charitable giving is significant in Ohio and plays an important role in financing nonprofits and the services they provide. Individual charitable giving represents about 75% of overall philanthropy in Ohio, but only small amounts of that trickle down to the human services. Private foundations make up about 20% of charitable giving in Ohio, and many fund social service nonprofits, primarily through grant making. Often founded by wealthy philanthropists, private foundations do not typically solicit funds from the public and instead rely on endowments. There are over 3,000 grant-making foundations in Ohio, with combined contributions of about $1 billion, of which about 15 to 20% goes to the human services. A diverse range of professionals from different educational backgrounds work in the human services. This includes those who studied social work, family studies, psychology, public health, political science, and many others. The human services field is also made up of those who may not have completed a related degree, but who have years of experience helping others. There are tens of thousands of human service professionals across Ohio, and in most areas of the field, job growth is projected over the next decade. Wages for human service professionals vary considerably based on sector, public or private, education, experience level, and setting. Thanks for taking the time to learn about human services in Ohio. For more information or to view videos on other areas of the human services, visit our website at www.communitysolutions.com.